Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about home-based care. We'll learn about home health care, hospice care, and palliative care. We're going to start first with Christine Cafferey, Home Health Patient Coordinator, who'll talk with us about home health care services from St. Tammany Health System. Welcome to the show, Christine.
Good morning.
Glad to have you here. So let's start really simply and kind of define what we mean when we use the term home health.
Sure. Home health is skilled care provided to the patient in their home. And the services we provide are nursing, therapy, social work, and home care aid services. So if a nurse is needed for the patient, they generally will go in and educate the patient on their medications, their disease processes, the things they're having problems with. We can also provide skilled care such as wound care, IV therapy, and different other aspects of what needs to be done to take care of the patient. Physical therapy, occupational therapy, and speech therapy are offered through our services, as well as social work evaluations, and if a patient really needs help with a bath, we can provide home care aid services.
Okay, so you've got nursing care, which would be specifically those kinds of actual interventions that you mentioned. And then therapy, you said speech therapy, occupational, and physical therapy can come in the home. And then certainly social work. In so many cases, we need social workers to take a look at that situation and help in the home. And then a home health aide can help with things like bathing and some of those daily tasks that may be too difficult for that patient at the time.
Correct.
And so how would someone qualify into home health to get that kind of care in their home?
Sure. What we need is a doctor's order to start home care services. We would then send a nurse or therapist to the home to evaluate what's going on in the home and where we may help the patient. So once the nurse or therapist evaluates the patient and makes sure that they are homebound to receive services, then our doctors will help us to develop what plan of care they need, and then we can start services. For most of our population, homebound status is a key determining factor. Medicare requires this, and so patients coming out of the hospital who are weaker are definitely more homebound. They're not out driving in the community just yet. So home health tends to be short-term until a patient is able to meet their own needs and start driving again, maybe attend outpatient therapy.
Okay, so it's kind of a ramp. Now, is it always triggered by a hospital stay?
Not always, but we do get the majority of our patients from post-hospital stays. We can receive referrals from rehabs, SNFs, and also the physician's offices.
Okay. Now, you just said SNF. I think we want to talk about that. But from a rehabilitation facility might ask home health to be involved after that patient leaves the rehabilitation facility and goes home.
Correct.
And then SNF, that's skilled nursing facility.
So if a patient has been in a nursing home, then they want to transition back to home, we can offer our same services to help them kind of get a little stronger and be more independent.
Okay. And then, of course, we mentioned the inpatient stay at a hospital. You might have home health transitionally after you went home from the hospital. But then you said sometimes a doctor will refer someone into home health, not from a facility.
Sure. So if a patient is having problems with their blood pressure and need more frequent monitoring, then a nurse can go in several days a week, help the patient get their own blood pressure cuff, manage and monitor and write down those blood pressures, report back to the doctor, and then he can decide if a medication change is needed.
Okay. And so it sounds like there can be any number of reasons that a patient might need home health care and qualify for it. Would you say that it is costly, or how do people qualify to have it covered or paid for?
Sure. For our Medicare and managed Medicare clients, those insurances do cover home health care with no out-of-pocket to the patient, most plans. Sometimes we do have to get an authorization So we would definitely be in touch with that insurance like Humana. They may want to know ahead of time what our plan is. So if we plan on seeing the patient 4 times for a nurse and 6 times for a therapist, they want to approve that prior to us providing those services.
Okay, so depending upon where that patient came from and what their diagnosis was and what their needs are in the home, our home health team would work with their insurance to work out what the plan of care would be covered and how that would work.
Correct.
And obviously it's all overseen by that patient's doctor in terms of what they felt that the patient needed in the home.
Yes.
Okay. Let's talk for a minute too about what St. Tammany's Home Health specifically can bring into the home that maybe is a little more specialized than your average run-of-the-mill home health service.
Right now we have 3 programs that we're talking about. We have a telehealth program where we can bring in portable units to the patient's home, and they can check their vital signs, including their blood pressure and weight. And these readings are transmitted through the computer to a staffed computer that we have in our office, so we can check their vital signs on a daily basis. And this is really helpful when we see some trends that are not looking so well, that we can report that to the doctor for an immediate intervention.
Okay, so you bring technology into the home, you get set up with the patient, maybe a family member, depending on their situation, and that enables them to sort of report in daily, where with a home health nurse coming, that wouldn't happen daily.
Correct. And so we can be in touch by phone, and then if we see that the patient's really not doing well, we can do an extra visit to check on their status. And if things are going even further down, we can call the doctor and see if we can get them into the doctor right away.
Okay, so the idea there is someone, let's say, maybe had a hospital stay, possibly, let's say, for a heart procedure, and they've gone home under home health care, and they're getting better, things are looking good, but you need to make sure that their weight doesn't fluctuate because of water retention, or their blood pressure is as it's expected to be. And as long as those numbers that they're registering through the computer each day are staying stable or within a range that you know is acceptable, everything's great. But you start to see an outlier, and that's where you need to work with that patient, maybe come back out to the home. And I like the idea that that can re-engage the physician before this patient winds up coming back through the emergency department or otherwise back into the hospital.
Right. One of the big focuses on this program is to prevent rehospitalizations. So I think that it has saved a lot of people in our small company from going back to the hospital.
That is wonderful when you think about how traumatic it is for that fragile person who's, you know, got this heart condition or plenty of other conditions that maybe brought them through the hospital once, to finally get well enough to get home, to get on their way, and then to find themselves having to go back. So that's a wonderful service and a great way to use technology. I'm excited about that.
Thanks.
Now, I think there's one other specialty service that we do. Is that lymphedema?
Yes, we have a physical therapist who's specially trained in lymphedema training, and she can do an assessment and evaluate if the patient needs compression therapy or special exercises to help decrease the edema that they have.
And I think that's interesting, that word lymphedema, because a lot of people don't realize what that means. Edema simply means swelling, and so this is a swelling around lymph nodes, and it's often in the upper arms.
Arms or legs.
And legs, okay. And it's there's a certain amount of therapy that can help move that fluid along.
Right, right, yes.
And so I think it's wonderful that we've introduced that as part of our home health offerings, because that is unusual in home health care.
Yes.
Okay. Well, it's been interesting to kind of learn a little bit about home health and kind of understand how it works. It sounds like it's a transitional opportunity to get back to good health and to have some health care, nursing, therapy, social work, and an aide who are available in the home.
Yes.
Well, Christine, thank you so much for coming in. This has been really helpful to learn about home health care.
Thank you.
Thanks for coming. You're watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson. We're talking today about home-based care. We've visited with Christine Cafferey about home health, And next, we'll hear from Stephanie Launey, who'll talk with us about palliative care. We'll be right back.
Here on the North Shore, along these halls, there are many minds at work. At St. Tammany Health System, many innovations happening now, and even more on the horizon. Many reasons we're number one.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson. We're talking today about home-based care. We talked first with Christine Cafferey about home health, and we're going to talk next with Stephanie Launey, palliative care nurse practitioner, about an area of home care called palliative care. Stephanie, welcome to the program.
Nice to be here.
Thanks so much for coming in. Now, I think people are pretty familiar with home health, and we learned some interesting things about our own home health this morning that are unusual and special, which is really neat. And I think people kind of know the term hospice, even if they don't know a whole lot about it. But there's this place in between called palliative care that I think a lot of people don't understand. And so if you can, just start off with, what is palliative care?
So palliative care is an extra layer of support for patients and their families. They may not be quite ready for hospice. They have a chronic illness that they've been dealing with for years. They have a cancer that they're having burdensome symptoms. They are ready to have difficult conversations. We're there to support the family and the patient as they go through all of that.
It's interesting to think about how people qualify for each of these different types of home-based care. And we talked a little bit about how people can qualify for home health. Tell us a little bit about how people qualify for palliative care, because that's different.
Yes, so usually a patient can be referred by a doctor to our clinic, or we see them in the hospital. Usually they have a chronic illness, say heart failure, and they've reached a point where they need extra support. They're having a lot of shortness of breath at home, and we're there to kind of help manage those symptoms and help talk about their goals. And we look at the bigger picture. We look at the whole person and trying to make sure they have a good quality of life as they're dealing with those chronic illnesses. So anyone with a chronic illness such as COPD or heart failure or cancer, and they need some extra support and extra symptom management, they usually see us in the clinic for.
Okay, so that may be home-based, or it may be in the palliative clinic with an appointment.
Exactly.
And would you say that palliative care is always triggered by a hospital experience?
It can be, but it's not always. We do see a lot of initial patients in the hospital, but a lot of times an oncologist or a pulmonologist will refer their patients to us for extra symptom management or just extra support.
Okay, so it may not be in the case, as we were talking with Christine earlier, a lot of times home health comes through a hospital stay or a rehabilitation facility or a skilled nursing facility, something like that, although it may be a doctor who's prescribing home health. But from a palliative standpoint, in many cases, it may or may not be driven by a hospital stay.
Right.
You may have someone, like you said, who has COPD, which of course chronic obstructive pulmonary disease, and so someone with a long-term lung disease. Mm-hmm. And you mentioned CHF, congestive heart failure. Someone who has cancer and maybe a terminal diagnosis of cancer. Mm-hmm. So in those situations, that specialist that they are seeing on a routine basis for their illness may suggest that palliative care would be a helpful part of their care.
Right.
Okay. So similarly to home health, I'm thinking about if my family member has this diagnosis, is under this care, and the doctor has said, you know, I really would like for you to talk with the palliative care team to understand what they may be able to help you with at home or in their clinic. Mm-hmm. Is that patient going to be able to use their insurance, or how is palliative care paid for?
So we accept all insurances, and we kind of cover out-of-pocket cost because we try to make it about quality of life, and so we accept all insurances, and all insurances usually cover palliative care. So it's like another specialist that you're seeing.
Okay. So you wouldn't have a worry that this was something you were going to have to come out of pocket or come up with a
Right.
way to pay for. And it may be in the home, and it may be also in the palliative clinic, or some combination of those two. But talk a little bit about the types of care. So from a nursing standpoint or therapy, what
In the
kind of
home.
care?
So in the home, we would see the patient about once a month, sometimes every 2 weeks if they really need extra help with their symptoms. We have a social worker to help evaluate the home and see what other services they might need. And we just take a look and see what they need at home as far as do they need any like equipment at home? We can kind of help assess that. Any kind of extra medications to help with their breathing or their pain at home.
Okay. And then in the clinic, is it similar or a different
So
situation?
in the clinic is pretty similar. So we usually assess the symptoms that they have, and that's our main focus. And we also refer out a lot to other services like psychologists or psychiatrists if needed. And we have a lot of extra therapies in the community like music therapy and things like that we can refer people to.
That's pretty fascinating. So let's talk about that for a minute, because I think, you know, we were talking in the first segment about home health. We're very focused on the health and well-being of the physical body, although certainly social work is a component. But it's generally transitional after something has happened and getting that person back to their level of activity and health. Palliative care is more a recognition of how do we create the most comfortable quality of life for someone who is faced with a long-term terminal illness. And so there are aspects of it that are physical health, but there are significant aspects that are social, emotional, mental health.
Right.
And we have a music therapist at St. Tammany Health System, and so she is a big part of palliative care.
Yeah, we like to use her when possible. So
Can you talk a little bit about how that works? Is that maybe the social worker determining that that's a good idea, or does music therapy pretty much always have a role at palliative care?
So we kind of feel the patient out. We ask the patient if they would be interested, and from there we kind of refer, because not everyone is interested. But if it is something, I've heard good things that have happened with just patients who can't communicate necessarily, but are able to play musical instruments and interact with the family that way. So it kind of helps with the families too as well.
That's fantastic. And I think singing can have a component with speech therapy. So when they're trying to work with a patient on their speech and the functioning of the throat and mouth and all of those things, because it's not just speech, it's all of that function, that music therapy can have a component there.
Right. So it's really helpful in a lot of our patients. And it's looking at the bigger picture. So helping the patient live the best life they can with their illness.
Helping the patient live the best life they can with their illness. I really like that. And I think if we were going to try to sum up palliative care, that really would be it. Because you have all of the health care opportunities of home health. You have nursing care, you have therapy care, and you have that social, emotional, and mental component. But you also have the ability to look at, okay, we are dealing with a patient who is faced with a terminal illness. They may have a long time to live with that illness, and how do we make the most out of the time they have left here?
Exactly.
That is really admirable, and I think more people would benefit from palliative care. So hopefully we've done some good things today educating about what palliative care is.
Yes.
Well, thank you so much for coming in. It's been a blessing to have you.
Thank you so much.
You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about home-based care. We learned about home health care from Christine Cafferey, and Stephanie Launey taught us about palliative care. Next, we'll hear from Jeanne Goubert, who'll teach us about hospice care. We'll be right back.
Just this morning, optimism and strength prevailed. Many hopes became reality at St. Tammany Health System. Dedicated to more little miracles. And the bigger ones, too. One of many reasons we're number one.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about home-based care. We've learned about home health care and palliative care, and next, Jeanne Goubert is going to teach us about hospice care. Welcome to the show, Jeanne.
Thank you. Good morning.
Thanks for coming out. So we're talking about home-based care, we're thinking about the different types, and we talked first about home health care, which has sort of a focus on a transition. It's expected to be a certain amount of time, maybe after a hospital stay or some other incident that is leading a doctor to prescribe that temporary period of care that we're going to be in the home providing nursing or therapy. And then palliative care, I was really kind of fascinated to learn is very transitional, and it is a recognition that someone may be in a terminal illness for a long period of time and need home care or clinic-based care. But then hospice is a whole different area of home-based care, and it can sometimes be in a facility as well, but primarily home-based. And so tell us a little bit about what hospice care really is.
Sure. So what hospice care is a focus on symptom management. Treating the patient's physical, emotional, spiritual needs, ideally in the home setting, where they can be surrounded by family and loved ones rather than in and out of the hospital. So the focus is less on curative medicine and aggressive treatments and more on symptom management.
Okay. So people who qualify for hospice care, you have to meet certain markers in order to get into hospice care.
Yes. One of the qualifications to be eligible for hospice is you have a disease process that the doctor feels if you were to allow it to run its natural course without aggressive interventions, that it would be possible for a patient to have a life expectancy of 6 months or less.
Okay, so hospice is very focused on that end of life period of time. So with that terminal illness that we talked about in palliative care, you may have months or years sometimes that you are in that awareness and treatment of your terminal illness. And so palliative can help you to make the most out of the time that you have. And then near the end, you can transition from palliative into hospice.
Correct.
To have the quality of life that you want in those last months, and the hospice team is going to help with that.
That's correct.
So there are some differences in the type of care that's available in home health or palliative and hospice.
Yeah.
Let's talk a little bit about what kind of care you can have in hospice care.
So the big difference is the hospice team has a medical director, so you're not going back and forth to multiple doctor's appointments to be managed. So we have a medical director that's over our department. And then under that, you would have nurses that come out to the house, similar to home health. Home health aides come out to make sure patients are getting bathed and just kind of take that stress off the family to make sure that they can have that. We also have medical social workers that are there for emotional support and also to connect families with community resources if needed. We have a chaplain on staff that is there spiritually for the patients. We are able to provide any medical equipment that a family may need to manage the patient's care at home, whether that be a hospital bed, wheelchair, oxygen, whatever would make it easy and safe to care for that patient. Also, the big thing for us, or a big difference rather, is medication. So when a patient qualifies for hospice under a certain diagnosis, any medications pertaining to their symptom management of that disease process is covered by the hospice benefit. So you would no longer need to go to the Walgreens or CVS to get those medications. And any of the diseases that are not your terminal diagnosis, the doctor can also order the prescriptions for those. So it takes away a big burden of, going to this doctor this day, this doctor this day, especially for a patient who's maybe in pain or it's really taxing and difficult. They're short of breath and it's hard to get them to and from their doctors. So the nurses are kind of the eyes and the ears for the physician.
Okay, and so someone who has qualified into hospice, you kind of mentioned that there are costs associated with the healthcare that they're faced with. So how is hospice paid for?
So hospice is paid for usually through Medicare. Medicare is 100% covers hospice. So you have a Medicare benefit. There's no charge for any of the services, the nurses, the medical equipment, all those services that I mentioned, they're all covered 100% under Medicare. So those patients will never receive a bill. Their families don't have to, worry about the bill. Those patients who have private insurance, most private insurances have a hospice benefit, and so there may be a deductible. We would run that. We would speak to the insurance companies and find that out, and relay that to the patients. But usually there's almost always no cost to the family.
That's wonderful. And so it sounds like for patients who need home-based care, if they are in end of life, life expectancy somewhere around 6 months, that hospice would be the team that would care for them, and it sounds like also their family.
Yeah, so a big focus in hospice is to provide support to the family. A lot of what we do is education, preparing the families and the patient for the progression of their disease, what can they expect, so that it's not so alarming, and we're not reacting. We're kind of learning about these things ahead of time, so that when it's happening, we can spend that time being with our loved one instead of being in a panic mode. And so social work is great. They see all the patients, all their families. One thing I forgot to mention is that we also have bereavement services. So we follow our patients' families for up to 13 months, from children all the way up to spouses. And if it's if they're needing a little bit more support, then our bereavement coordinator will reach out to the community resources for that. And so a lot of what we do is for the family.
Well, that's interesting. So in addition to providing nursing care or home health aides, whatever medical care that patient needs in that end of life period, you are also interacting with that patient's family, recognizing those psychosocial needs,
yes,
and some of the mental health issues that they may be facing. And then even after the patient passes away, your hospice team is still caring for that patient's surviving family.
Exactly.
To help them with the bereavement period, to kind of process what's happening to them and be able to kind of adjust themselves back on with life in the loss of their loved one.
Correct.
That's really special. I think, so often in our industry as a health system, we're so focused on birth and health and wellness and all of the things that happen in the arc of a long life, and we're recognizing we have it right here in our home-based services. We have home health,
yep,
palliative care, and hospice care, that recognition that there's a big component at the end of life where it's not just medical care,
right,
but it's social work, and it's the general mental state of the folks in the family who are losing a loved one.
Yeah, it's a journey. It's a patient's journey that the whole family is on. So our goal is just make sure that the patient is comfortable, has quality of life for the time that they have left, and that the family is well supported.
That is beautiful. Well, Jeanne, thank you so much for coming to talk about hospice. I think it's such an important component to the health system as a whole, and just a real benefit. Thank you.
Thank you.
You've been watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we talked today about home-based care. We examined what home health care offers in the home, as well as palliative care in the clinic and in the home, and then hospice care near the end of life in the last 6 months at home and sometimes in facilities. Thank you so much for joining us. We'll see you next time on Healthy Living.